Meanwhile, our Ministry of Health is launching a public health campaign around coronavirus. 6 people in New Zealand are currently being tested for COVID-19, but the Ministry says that these are mainly precautionary tests and aren't necessarily suspected cases of coronavirus. The campaign will encourage people to be vigilant with washing and drying their hands, and the Ministry says with the flu season approaching in April, there will be an added emphasis on the need for people to get their flu jabs. The flu shot won't protect people from coronavirus, but if people are already sick with something else, they are at greater risk of contracting a more severe case of the coronavirus. Director of Public Health, Caroline McElnay, says it wouldn't be easy dealing with the COVID-19 cases and flu season at the same time, but health officials must prepare for that possibility.
That would be a challenge, and we acknowledge that as a challenge. What we can do with flu season is make sure that as many people as possible get vaccinated with the flu vaccination, and that at least will hopefully reduce the impact that we have from flu.
Caroline McElnay says any vaccine for the coronavirus would probably be about 18 months away. Meanwhile, the World Health Organization has advised hospitals to have isolation rooms ready to go. The Prime Minister, Jacinda Ardern, says hospitals are prepared.
We have already done an assessment of every DHB and our hospitals to assess their ability to make sure that they have appropriate rooms for isolation, appropriate bed space as required.
And the Ministry of Health is promising to fill gaps in health clinics which say they've run out of equipment they would need to respond to a coronavirus outbreak. This morning, the College of GPs said many doctors' clinics have run out of protective gear like masks. Director of Public Health, Caroline McElnay, says the Ministry is talking to primary health providers and will get resources from overseas if needed.
That's part of the assessment. It's making sure what we've got in country is well distributed, but then also what else do we need to get in to New Zealand so that then we can keep that supply chain going. And we are ensuring that supplies of equipment that they need will get to those practices as soon as possible.
Caroline McElnay could not say exactly where the gaps were, but says a health coordination centre is working with the places in need.